Thank you.
I promise. Hey, everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, it's Monday, which means it's time for Monday with the McDougalls. And if you watched 2 weeks ago, you know that Dr. McDougall gave a wonderful lecture on the upper GI tract, but the GI tract is very long. You can't do it in one session. So today he's going to give another brand new lecture, this time on the lower GI tract, where so many people seem to have so many problems. But before I introduce Dr. McDougall, I'd like to introduce a special guest who wrote to me. You know, I get so many emails from people wanting to be on the show, and usually they show me a before and after picture where they've lost a considerable amount of weight and they want to tell their story. Well, this email was a little different, and it really tugged at my heart. The lady's name is Bethany Russell, and about 8 years ago, she was a star McDougaller. These are people that have tremendous success following the McDougall program, reversing their disease, losing weight, and they get to be on his website in a special section. But she lost her way a little bit and fell off the wagon, or whatever you want to say, and she needs to get back on to reclaim her health. And I thought, what better way to do it than just telling Dr. McDougall personally for inspiration? Please welcome Bethany to the show.
Hello, thank you so much. Yeah, I'm really happy that you let me come on today. And I just, I knew I was going to be kind of nervous and probably forget something that I wanted to say. And so I actually typed a couple paragraphs. And if it's okay, I'll just read it. Is that okay?
Absolutely.
Okay. So, before 2014, I was an active mother in my early 20s, a runner. I played the piano and I had no health problems. After the birth of my second child, however, everything changed. One moment I was normal and the next moment I was disabled. If I wanted to move a finger, I couldn't. If I wanted to take a step, I couldn't. Within days, my body was in excruciating pain from head to toe. It felt like someone took a key, locked every inch of my being, and threw the key away. My husband would feed me. I went to the bathroom next to the bed because I couldn't walk across the room. I'll never forget the day of my first diagnosis appointment. My husband pushing our toddler and newborn in a stroller and returning to push me in a rolling office chair. We made it to the elevator of our high-rise apartment and we got in the car, but I couldn't lift my foot off the ground and I couldn't raise my arms to hold on to anything. I was diagnosed with advanced ankylosing spondylitis and rheumatoid arthritis. My RA factor was 714, off the charts, CCP, ANA, antiphospholipid, CRP, sed rate. But months later, I found an article called Only Hope for Arthritis by Dr. John McDougall. It is through this article that I found the data surrounding water fasting and elimination diets for inflammatory arthritis. I applied the information to my own life, beginning with a 5-day water fast. The results were remarkable, and from that moment, I knew my condition was related to food. I shared with doctors and specialists, but they reassured me food had nothing to do with my condition. But I knew they were wrong, so I tried it, and it is through Dr. McDougall that I learned of an elimination diet consisting of fruits and vegetables and rice, and I learned about Dr. Walter Kempner. And so for 3 years, I ate fruits and vegetables and rice equivalents, and the results were life-changing. I was able to walk, and I regained most of my mobility. I lost 90 pounds as a side effect, and I was a star McDougall. To make a long story short, I stopped the diet. I stopped following the diet. Fast forward several years, I have been on and off treatments. I gained 5 to 10 pounds a month. I am back where I started, fat, sick, and bedridden. I've added more conditions, and I reached my highest weight of 256 pounds. And in the last 18 months, I have remained in bed, and I use a power wheelchair to get to the bathroom. This didn't happen overnight. 3 years ago, we were moving to one-level housing because I was falling down the stairs. And the last sentence I wrote is that I contacted Heather McDougall, and she encouraged me to try the rice diet. And I have been doing it now for 6 weeks, and I've lost 35 pounds, 6 inches off my waist. My blood pressure went from 147 over 100 to 120 over 80. And I have been sitting up in bed after only being able to lay flat.
Good. Yeah, it's a very interesting story. You know, with you knowing exactly how to get well, I guess you kind of fall into Doug Lyle's field as to why don't you? And I don't know whether I can offer you the kind of sympathy or empathy that you deserve, because you know, as a doctor, I kind of look at it from the point of view of what you got to lose. I mean, it doesn't cost you anything. There are no side effects. You have a child, a lovely husband. It sounds like you have a pretty darn good life. Can you tell me why you decided that you were going to go back to your old ways? And I asked that, you know, understanding a little bit about addiction myself. I think you have to be an addict before you can really understand. I've had my share of addictions in the past, but I've never had one to food, but I know how it can be to other things. And, you know, so if you're going to tell me that you're addicted, I could probably relate, but if you're going to tell me some other reasons, I'll learn something new.
Yeah, so it wasn't really a food addiction, and I certainly regret the decision. And we had a lot of problems in life, and I struggle with, I just have a lot of struggles. And we went through a time where we had to live in a hotel for 1 month. And I just made the decision to eat. We ate only fast food for 1 month. And I just slowly but surely completely stopped the diet. I had 4 miscarriages. We were in a financial crisis. We lost our property and we had to move. And I have PTSD because I have a lot of trauma in my past. And so I just kind of, I'm very nervous, but I just got to the point of not taking care of myself. But now I'm in a place where I need to get better, and I'm ready to do the diet.
We'd like to help you. I think that's why our program is well-rounded, with people such as Dr. Doug Lyle, who takes care of helping people. And in this case, you know, from my non-professional psychological point of view, I'd say help people like themselves. It sounds to me you got into a situation where you didn't like yourself very well. And that's something that, again, falls outside of my expertise, is how to get people to like themselves. Because, you know, and that's one of the, people ask me so often, they say, well, you know, who's going to follow the diet and who isn't? And my answer is, well, you have to at least be able to understand what a 7th grader understands. You know, you got to have that level of reading skill. And you have to like yourself. That's the only two criteria that I know of that must be applied. And I think your problems are really deep. And let me just leave it at that and go on to some things that I would suggest you do from a practical point of view. As I would pick the things that you really like as far as the McDougall diet goes, and realize that you can live on basically any starch, along with a couple of fruits and vegetables, so you don't have to make a big deal of this. And if it's not troublesome, you can eat a lot of different spices. Are there foods that you like, Bethany?
Yes, I actually really love the diet. And it took the first couple of weeks again were pretty tough. But then it's like a switch turned on, and I just really love the food. And I really don't have a desire to change.
So you think you're back in, so they say, back on the wagon again, huh?
Mm-hmm. Yeah.
Oh, well, then you ought to do really, really well. We realize this again, you know, I can't be everything to everybody, and that's why we have such a diverse program. And that's why we attend to things like, you know, trying to make our program very personal as far as its contact goes. And not that I'm trying to talk you into joining up for the internet program, but, you know, the kind of help that we decided we had to give people when we switched to all internet programs, we had to develop some way of having it personal. so that we could get into your lives and you could get into our lives. And so we have 3 support specialists who meet with you not only every morning, but all day long if it's necessary. And they're Corey and Stacy and Tiffany. And they've worked with us for years. And they're very, very good at helping you, pick different things for breakfast and, helping you plan your meals and helping you dealing with things like going to parties and having guests over. And, so that's real helpful out of that personal point of view. The other thing that Mary and I and Heather do is we meet with everybody every morning in a fireside chat. And that seems to be something people like also. And then there's a third component that we put in, which goes beyond just being a doctor, which I've spent my whole life doing. And, that is that we have, a tremendous amount of interaction with people. We have a doctor that sees you, spends time with you. And we know how important it is for people to have a community relationship. And so we step aside every day and the participants, be there 30 or 40 or 50 participants, they get together for an hour or two every day without any of our staff being there at all. And they kind of talk about how their experience has been. And people often let down their guard a lot more than, when they're standing in front of Dr. McDougall. It gets a little nervous at times, I know. And so, we've tried to make as much of a personal action as we can. And of course, I've mentioned Dr. Doug Lyle, who's the best psychologist in the world. And he really gets results. And Dr. Lyle sees people on a private basis too. So we're trying to be as well-rounded as we can be. And if there's some of those things that were mentioned to you that you think we can be helpful with you, I would like you to contact Heather, and she will help you. I know you have a lot of trouble financially. At least you've told me you have recently. Hopefully your fortune has changed. And there may be some ways that Heather can help you out.
Thank you. Thank you so much. I know that sounds amazing. I really appreciate it. And I do want to say thank you. Like the article, Only Hope for Arthritis.
Yeah.
If I hadn't found that article, I don't know if I would have ever heard of this option from any of my doctors. And
no, you wouldn't have. I guarantee you wouldn't have. Yeah, that's an article I wrote probably 20, 25 years ago. Diet, the Only Hope for Arthritis, and it's on our website. So it goes through the scientific research up to that point that was available at that time, which included things like a study from England, which was published in the Lancet, where they took people with rheumatoid arthritis, you have rheumatoid arthritis. You also have ankylosing spondylitis, but it doesn't matter what you call it. You have inflammatory arthritis, so calling it one name or another doesn't really matter. But they took people with inflammatory arthritis and they put them in a confined situation where they controlled everything they ate, whether it was at a resort, I don't recall. And they put them on a fast, initially, a juice fast. And all the people got well. It was 100% success rate. And then they followed them up for a couple of years. And those who stuck with the diet remained free of their rheumatoid arthritis. So this was published 25, 30 years ago. And you might sit there and ask, well, why isn't every doctor telling you about this study and the other 30 papers that I presented in that article, Diet, the Only Hope for Arthritis?
Mm-hmm.
Well, it has to do with money. I hate to say it, but the older I get, the more I realize that cliche is absolutely 100% true. People's souls can be bought easily, and their minds can be bought easily, and it's doctors are no different than the rest of the population. And you give them a financial incentive, which they have in a practice of medicine that deals with drugs. Mary and I were talking about this a couple of months ago, and she was listening to all the ads on cable news network about these different drugs used to treat autoimmune conditions, many of them rheumatoid arthritis and lupus and other conditions. And she said, well, they're making so much money, but how in the world do they keep getting so many clients, so many patients? And I said, well, once the advertisement is played and the listener, the viewer, sees what's going on, the next step is to see their doctor. And so the doctors are rewarded. So it's not just the drug companies, the whole medical business becomes involved in this. And it's just a cascade of millions and millions of dollars. These drugs, by the way, cost 20, 30, 40, sometimes as much as $70,000 a year just for the drug. And that's basically what it comes down to. And, you'd think, and this has been kind of a theme I've had my whole practice, you'd think that the doctor would start out, or the patient would start out and say, well, why don't we try this first? Why don't we try and fix it with food? I've got nothing to lose. There are no side effects. It costs me absolutely nothing. And then if that doesn't work, I'll take the shots and the pills or the surgery. That's always available to you. But unfortunately, too many people skip to the financial reward. And of course, when you're a patient, you say, well, I don't have to do anything. When I take the drugs, I just sit back and they poke me or put a pill in my mouth. Well, you do have to do a lot of things. You have to keep going to the doctor. You have to be sick all the time. You have to spend money you could spend at Disneyland with your kids on these pills. So it's quite a burden on the patient if they stop and think about it. It's expensive. It's convenient to be sick. And but somehow or another, I've been doing this for 50 years. I certainly haven't figured out how to change that many people. But I'm glad you're on the right track.
Thank you so much. Yeah, it's been an honor to speak with you today. I really appreciate it.
Oh, please do check back in with us. And it sounds like you have a relationship with Heather. And she's got the same problem I have, and that is she likes to help people. So.
Hey, Dr. McDougall, Bethany was a star McDougall, but when she relapsed, she asked to be taken off your website. When she gets her footing again, can she be put back on as a star McDougall?
Oh yeah, and I'd love to tell the whole story, not just the success part, because people need to hear that this can be difficult, and you shouldn't stop trying just because it's difficult. When I told you I've been addicted in the past, I can tell you about one of my addictions, and that was to tobacco, which I quit October 20th, 1972 at 7 a.m. in the morning. I quit 11 times before I finally quit in October of 1972. And you know what? I don't consider myself completely free to this day. And I know the only way that I prevent relapsing, I mean, this is real personal to me, is I just can't do it once. I can't have one cigarette, because it has so much power over me. And as I mentioned, if something like tobacco can do that to me, then I could just imagine what food must be doing to other people. And I think you got to take the same rules. You got to realize that that every time you quote fail, you learn something new about yourself. I learned that you don't date women who smoke cigarettes because they get you smoking again. I learned that you don't say to yourself, well, let's see, I quit for 11 days. I'm probably cured. I'll just have one, because it always failed. And once you try all these tricks, you finally get to the point, which I've done since October 20th, 1972, being able to control the situation. But I realized I just can't have one. And I try and disassociate me from environments where there's tobacco in, because it still smells good. And it must be just as painful for food. I just can't relate to that one. But I have my share of fallings that I don't need to understand them all.
Great. Well, thank you so much. Bethany, please check in with us. I know you want to be on the show as a solo episode, so let's be in touch, and please check in with us regularly, okay?
Yeah. Boy, it sounds like you got a supportive husband too, and that's key. You guys work together.
Thank you. Thank you so much.
Bye-bye.
Thanks, Bethany. Thanks.
Bye.
Dr. McDougall, I love what you said, because that you understand that even though you don't have the personal addiction of food, that you understand that other people do, and that's why it can be so difficult for them.
Yeah. Yeah. Well, like I say, we're not going to go into all my bad habits, but.
Well, you have a good habit now. You're wearing a nice shirt every time. Linda even commented what a great shirt. And so did Amy. People are really commenting on your clothes now.
Well, you know what? I've got to do everything to get your attention these days. Wait till I take off all my clothes and I stick carrots in my ear.
And then we'll see if you really do have that tattoo. Do not cath or I will sue.
Yeah, do not cath, I will sue. Well, I've said that many times. As the difficulty is to get people to listen to what I have to say, and if that's what it takes to get your attention, I do it. I take off my clothes and I stick carrots in my ears, and give my lectures that way. It's not as pretty a thing as it once was, AJ.
Yeah. Well, you're looking great. So GI tract, it's amazing how many people go to their GI doctor and they never ask them anything about what they're eating.
Well, of course, it's so obvious that what you put in your bowels would affect their health and determine whether they are in good health or they're sick. But that kind of logic is rarely communicated from the doctor to the patient. And even if it is, no practical advice is given about really what to eat. You're told you can eat a keto diet, or you can eat a full mat diet, or you could eat. Doctors know nothing about food in general. So, and they don't want to appear to be ignorant. They don't want the public to realize that the emperor has no clothes. And so they start making up things, and you pretty much figure out real quickly that they don't have any idea. But the intestinal tract is the portal of entry to the entire body. Everything pretty much has to go through the intestinal tract unless it goes through the skin or through the lungs. It goes through the intestinal tract, and that's where the bulk of the molecules go into the body, is through your intestines. You got a 38-foot long tube, which is set up for digestion, assimilation of the foods. And also it has a tremendous amount of barriers to prevent you from poisoning yourself. But it's not perfect. And as a result, it fails, and people get sick with autoimmune diseases and artery diseases like atherosclerosis and diabetes and so on. But they avoid a lot of problems, a lot of the bacteria. I mean, we have a world of viruses and microbes and parasites, and that we ingest every day, and the body protects us from most of these. Sometimes we take overdoses of vitamins and minerals, usually self-imposed by buying them and ingesting them, and the body doesn't die from, say, iron poisoning or magnesium poisoning. So it's pretty smart, that intestinal tract is. And in fact, it's so smart. One of the things that I was even taught in medical school, which was over 50 years ago, was the intestinal tract changes as far as its ability to absorb iron. If you are iron sufficient, in other words, you got plenty of iron in your body, then the cells in the intestinal tract, they block out the iron that you may eat. Whereas if you're iron deficient, what happens is these cells become very active, and they absorb a tremendous amount of iron from what's in the bowel. They're really smart. They communicate with the world around you, all those microbes that I mentioned, the viruses, the parasites, the prions, the bacteria. I mean, they talk to this world, and the immune system responds as a result of this communication and sets you up to defend yourself with its entire immune system. So it's not an inert tube sticking throughout your body. And by the way, the intestinal tract is the first thing that talks to you when you're good. And one of the things I tell people who get involved with our program, and we used to observe this all the time when we were in a residential program, and we observe this now, but it's by the internet, is that you'll get better. You'll get better like in 1, 2, or 3 days from your chronic constipation, your diarrhea, your stomach pains. It happens right away. And thank you. And the other thing is there's something called McDougall's revenge. And if you haven't discovered it, many people will, and that is they go out with their friends and family just for one dinner, one greasy Chinese vegetarian dinner, and they end up in the bathroom with McDougall's revenge. So it quickly responds to everything that you do right or wrong. So let's see if I can get some slides up here, and we can. And I got the sound share this time, which Mary was kind enough to remind me of, so that you'll be able to hear some interesting presentations that I have for you. All right. The discussion I'm going to have with you and that I had with you last week comes out of this book, which was first published in 2006. So that's 18 years ago. And it's still a national bestseller. You can easily get it at Amazon, and you can get it at most natural food stores still. It's quite a big seller, and that's, I think, because people have so much difficulty with their intestinal tract. Yes, AJ, this is what I used to look like 18 years ago. All right. It's a good book. It's the only book I'm aware of that really deals with the intestine very frankly, in an entertaining way. As a matter of fact, I had a comedy writer come in and go through the book and try and give it a little levity. And she did, not a lot, but she did, and made it a little bit easier to read. There are people who actually tell me that they read this book from cover to cover. They find it fascinating. And that's the way I wrote it, with that kind of intention to get your interest, because the intestinal tract is usually something people don't become involved in. This is a mysterious part of the body. It's an area of shame. And so to write a book about the intestinal tract would not start out as the most popular thing that you could do to make a national bestseller. But I felt a very strong need for it, particularly since, I'm a real doctor. I take care of real patients who have real problems. So these are some of the problems that it deals with. This communication was also helped greatly by Howard Bartner. Howard Bartner was the chief illustrator of the National Institutes of Health. This is a self-portrait that he did. I told you a story about Howard Bartner during our last presentation, and it's an interesting story to say the least. He became a patient via the internet, and it was a great help putting this book out. The illustrations are his. And Larry and Louise are the two people who help us go through the intestinal tract. And we started out explaining the intestinal tract is outside the body. And that's why it so quickly responds to all kinds of environments. Like I told you, you get well right away, and you get McDougall's revenge right away. And we divided the intestinal tract into an upper part, and last time we talked about the mouth and the esophagus and the stomach, and a little bit about the liver and the gallbladder last time. And we're going to talk about the lower intestinal tract this time. And we talked about obvious disease that occurs that dentists are well aware of. And this discussion last time went into a very important area, which is smelling bad breath, and why this is so important for you, and why people stink. And they stink because of the food. You smell like what you eat. And I remember reading some books about Inuit Eskimos, and how it was mentioned by the authors that the native people, they smelled of fish. And I've done enough traveling around the world where people eat different spices in different areas of the world. I quickly noticed that their body odor reflected what they ate. So you can imagine what Europeans and Americans smell like. They eat cows and pigs and chickens. You ever been to a barnyard? That's what they smell like. And when you change your diet to starches, vegetables, and fruits, that's what you smell like, which, could be strong, but it's not as unpleasant as smelling like pigs and cows and chickens that died. We talked about how your animal foods are high in sulfur. For example, beef has 4 times as much sulfur as beans, and tuna has 12 times as much sulfur as sweet potatoes. We talked about the esophagus, just the tube between the mouth and the stomach, and how people develop gastroesophageal reflux disease due to incompetence of the lower esophageal sphincter, and why they get reflux, which not only reflux up into the esophagus, which burns the esophagus, but also that stomach content goes up, way up, and goes into the sinuses, gives you sinusitis, gets on your teeth, takes the enamel off your teeth, and you inhale it, and it makes you hoarse, gives you a chronic cough, and also gives you asthma and bronchitis. We talked a little bit about stomach ulcers and how, yes, they're due to a bacteria, but you've got to feed that bacteria the rich American diet before it really becomes a problem. And then the gallbladder. All doctors know that gallstones are due to supersaturation of the bile with cholesterol. Well, where does cholesterol come from? Only from animal products in any significant amount. Supersaturation of the bile. The cholesterol stones, the gallstones are made of cholesterol. And we talked about what you should do with the gallstones. The answer, the bottom line is leave them alone. And if they hurt, eat a low-fat diet, and they stop hurting. Once you have them taken out, the problem is that half the people are still sick because they haven't changed their diet. And then in addition, they have problems like chronic diarrhea. So let's get into the lecture of today, which is the lower intestinal tract. After we leave the stomach and the first part of the small intestine, where the gallbladder and attaches with the common bile duct, we go into the small intestine, which is a real healthy part of the intestinal tract. This is where everything's absorbed. And I think the reason it's healthy is because this is where you get your energy. This is where you get your vitamins, your minerals, all your essential nutrients. They're absorbed in this section of the intestinal tract. And if you had disease in this part of the intestinal tract, your genetic material would be lost because you would die. So there are very, very few diseases related to the small intestine. There are a few autoimmune diseases sometimes, and there are some malabsorption problems sometimes, but otherwise, the small intestine is pretty much immune. So let's leave the small intestine, which would be right here. Okay, you leave the small intestine, you go into this area of the large intestine, which is called the cecum. You see the appendix hanging off here? Your appendix is in the right lower quadrant of your abdomen. So if you take your right hand, and you put it on the lower part of your abdomen, that's what we're talking about. Is this area right in here. Okay, this part of the intestine is called the ascending. Okay, I know your doctors are very uncomplicated in their terminology. The ascending colon, and then you have the transverse colon, and then you have the descending colon. You get into the sigmoid, kind of like an S, right? Sigmoid, and then the rectum, and then the anus. And that's the large intestine. That's what we're going to talk about over the next few minutes. That large intestine is the place where bacteria live. And I know Chef AJ's had some very important guests talking about the microbes that live in the large intestine, microbia, microbiome. Those are some of the terms that you've heard. And we've been talking about these for, 50 years. I wrote about them many, many years ago myself. And what it comes down to is that the kind of microbes that grow in your intestine, your large intestine, depend upon what you feed them. If you put bad food in your large intestine, the remnants of bad food in your large intestine, you get bad bacteria growing. You get what we call gram-positive Clostridium bacteria, and they'll make carcinogens. They'll make sex hormones. These are nasty little critters. Whereas if you feed them sugar, and of course you know that when I say sugar, I primarily mean potatoes and rice and corn, complex carbohydrates, you know them, and I call them starches. If you feed them remnants of starches, then you grow coliforms, which are the kind of bacteria, they're the healthy guys. And what's recently been discovered is the kinds of bacteria that live in a person's intestine are associated with whether or not they have heart disease or cancer or diabetes, et cetera. Why? Because of the same common denominator. If you feed food that causes healthy guys to grow in your intestine, it's the same food that prevents and reverses atherosclerosis or heart disease. It's the same food that prevents and or cures type 2 diabetes. It's the same food that cures autoimmune diseases. It's the same common denominator. This is the link is so obvious that you shouldn't have any question about what you need to do. In other words, you don't have to eat one diet for your arteries and another diet for your joints and another diet for your bowels. It's all the same diet. The ideal diet for people is a starch-based diet with the addition of fruits and vegetables. I think one of the more exciting findings as far as the microbiome is concerned is that they're focusing on the bacteria of people who don't have heart disease or rheumatoid arthritis or type 2 diabetes. And these were, for example, would be rural Africans. Now that's changing. That's changing rapidly. Ethiopia, Kenya, these countries where essentially the diseases of Americans were non-existent. But because of cable news network, because of the new economy and transportation, rich food is now imported into these countries, and they don't have any special immunity. They're changing the bacteria in their bowel, and they're changing their incidence of the diseases. Same thing in Asia. But the people in rural Africa have been studied and still are because they're essentially immune from the common American illnesses. And so they've analyzed their bacteria to find out what kind of bacteria grow there. And so a new business is emerging, and that is to sell you African poop. Yeah. They sell you bacteria that are associated with a low incidence of heart disease, obesity, diabetes, et cetera. You know why? Because of the same common denominators. And you shouldn't fall for that. You may want to do it one time, just to get those friendly bacteria imported from across the ocean. But you don't want to keep buying them. You just keep feeding them good stuff, and they'll hang around. And your primary approach to having good bacteria is to feed them correctly. You don't need to take prebiotics, which are sugars that they sell you in the natural food store in little bottles that the bacteria like to eat. I already told you what the bacteria like to eat. They like to eat potatoes. They like to eat corn. A lot cheaper than these little bottles of prebiotics. And they also sell you probiotics, which are the bacteria that you're supposed to eat, colonize your intestine with. This is not well spent money, folks. Just eat the right food, and your intestines will be healthy. So will the rest of the body. Remember, the intestine is the portal of entry of everything in the body. Yeah, there are lungs and skin, but pretty much everything that affects your body is through the intestinal tract. Oh, here you go. Here's the bigger picture of your large intestine. And off the large intestine, you see the appendix right here? Okay, right-hand side. That's where you get appendicitis. Oh, by the way, appendicitis, when I was a young man.
Hi.
I think I was about 7 years old when I lost my appendix. That's the way you used to treat it. If you got an inflammation of the appendix, in other words, you had appendicitis, you go to the doctor, and what they'd do is they'd go into abdominal surgery, and then they cut your appendix off. Well, even at that time in Europe, what they would do is they'd treat appendicitis with antibiotics. And these days, that's the way appendicitis is commonly treated in the United States. Is they'll make the diagnosis, and then what they'll do is put the patient on antibiotics and not do surgery at all. So the treatment has changed over the last many years, and of course, I think it's a lot easier on the patient and the patient's pocketbook to take a few antibiotics as opposed to going right off to surgery. Again, this is a case where you do the simple things first. If it doesn't work out, then you go on to more complicated stuff. Anyway, you wonder what the appendix is for. That's a question a lot of people have. We don't know. The idea is that it may be a vestige that occurs in the fetus that is important in establishing the role of the immune system. That's what I remember. But there are a few other theories. And the theories come about because so many people are living without their appendix. They had appendicitis, they had their appendix cut out. They stood still fine. Happened to be when I was 7. Survived all these years without an appendix. So obviously it's not that important, is it? Well, I think it is important. I just don't think we understand the role. So anyway, that's where your appendix is. The appendix, the reason you get appendicitis is because this opening right here, the lumen we call it in the medical business, this opening gets inflamed. You see that? Okay, it gets inflamed. You know why it gets inflamed? It's because of unhealthy remnants of partially digested food that make it sick, and it swells. And when it swells, it gets closed down. And then the fluids that are generated in the appendix, they accumulate. They accumulate in here, and then bacteria get in them, and they get infected. Now, what you'll hear, I used to hear it a lot, I don't know how much anymore, because it's not true, is that the reason that this lumen gets plugged up is because of eating seeds, like poppy seeds and raspberry seeds and any kind of seed. And it kind of makes logical sense, doesn't it? You get a little seed stuck in there. That's not how it happens. No, they look through surgical records, and they look at what the pathology lab found, and they don't find seeds in the appendix. And so that theory has been discounted. And by the way, you'll find the reference to that in the book, Dr. McDougall's Digestive Tune-Up. I put the scientific references in this book, just like I do in all my books. So if you want to read the original papers, it's available for you. And you'll see where it's completely discounted, or you can look it up yourself. And what an amazing world. You can go to Google, you can go to the National Library of Medicine, and you can just say there's some research terms, and almost always you get free articles. And you can read them at your leisure. You take the trouble to learn what the terminology means. They're not that hard to understand. All right, so I want to talk to you a little bit about this guy. This is the man who changed my life, Dr. Dennis Burkett. The story goes like this: is Mary and I met in September of 1971. She was a surgical nurse. I was a medical student, and I fell in love, even though she was half covered with a mask. It was love at first sight, and quickly we decided to spend most of our time together. That was September. In December of 1971, I went to a noontime conference. I used to hate these noontime conferences. Why? Because I felt so stupid. I'd sit there in the audience. Well, I was only a medical student. What could I expect of myself? And people would talk about these things, and often they'd talk over the top of my head. But they'd also talk about treating signs and symptoms. They never talked about the cause or the cure of these problems when it came to chronic disease. And I felt like myself, I said, this is why I went to medical school, to treat a bunch of signs and symptoms, and nobody will tell me what the cause or the cure is. So I was quite frustrated. I've been frustrated many times in medicine, but early on I was quite frustrated. Well, this man came to my hospital in Grand Rapids, Michigan, called Blodgett Hospital. And the reason he was there is he was traveling around the world promoting his new book about dietary fiber. Dietary fiber is the non-digestible carbohydrates in the food. Dietary fiber is not like the bristles of a broom. Like people think about it. They think fiber scratches your intestinal tract. That's not the way it is. Fiber are little molecules. The best way to think about fiber is like a potato. If you take and thoroughly cook a baked potato and you put it in a glass of water, it'll dissolve. And you won't notice anything at all because it breaks down into little microscopic chains of non-digestible sugar. It's the same chemical sugars that form starches. It's just the links between the individual sugars are non-digestible, which means these sugars pass through the intestinal tract without being absorbed. They stay in the intestine. Anyway, the story of Dr. Burkett is this. He was trained in Edinburgh, Scotland to be a surgeon. And after he finished his surgical training, he decided to go to rural Africa to work. And so Clive and Cleve and Walker and a bunch of his buddies, they went to Uganda and to take care of the local people there. And very quickly, Dr. Dennis Burkett became the head of ministries of health in Uganda, which meant his responsibility was to oversee 17 million people, 10 million people for 17 years is what he did. He had 1,000 hospitals to oversee. And so he collected a tremendous amount of information. And as an interesting man interested in disease, he noticed that the diseases he was trained to treat in England, in Scotland, they didn't exist. He didn't find any cases of heart disease or diabetes or hemorrhoids or colon cancer. He told in this conference, he told about the only heart attack he saw in 17 years among 10 million people. And that was a man who went to London and trained to be an attorney, a lawyer, and then came back to Uganda and had a heart attack. He saw one case of gallbladder disease in 17 years, one case, that was it. And then he started wondering what was the reason for this? And he decided it was the diet. I mean, that was profound thinking back in those days, that food had anything to do with disease. But he decided it was the diet, and he focused on the fiber part. But to put it into simple, universal terms, understand that fiber is only present in plants. No dairy product, no egg, no chicken, no cow, no pork, no fiber. It's only present in plants. And so he focused on plants, whereas he should have focused on the whole diet. This was a near vegan diet that these people were eating. Better termed, it was a starch-based diet. So he became famous in the second part of his career as being the fiber man. But anybody who's in business, or if you just had the experience, he also became famous for the discovery of a lymphoma. It's called Burkitt's lymphoma. This is a blood cancer. And where it occurs, Burkitt's lymphoma, is it occurs in parts of the world where there's a lot of malaria infections. And what's believed is that due to chronic infection with this parasite, malaria, the immune system is overstimulated and chronically stimulated to the point where it breaks down into a lymphoma. Burkitt's lymphoma, it's called. Every medical student learns it. And a few doctors see it. It's something that occurs on occasion. Certainly you see it more in malaria areas than you see it in places like the United States or Western Europe. But that's what Dr. Dennis Burkitt is famous for. So he, known as the Fiber Man, he came to Grand Rapids, Michigan. Why? Because he wanted to visit Kellogg cereal company, which makes high fiber cereals, which is in Battle Creek, Michigan, which is just a few miles outside of Grand Rapids. And on his way through to the Kellogg company to try and talk them to making more high fiber cereals, he stopped and gave me a lecture that changed my life. There must have been 200 other bodies in that room. But as far as I was concerned, Dr. Burkitt was only talking to one person, and that was me. He changed my life. For the first time, he told me there was a cause of disease. He didn't tell me how to cure it. He told me there's a cause. There's a reason people get sick. It's not due to bad luck, the wrath of God, not even due to their genes. It's something that they do. So disease was preventable. And I came home after that lecture so excited. I came home and I told Mary about what I'd learned, and she was excited for me. She's been with me for the last 50 plus years. And well, what are we going to do, John? And I said, well, we're going to change our diet. Based on what I learned, we're going to change our diet. And so we're going to start eating high fiber bread. And so what we did is we switched from white bread to brown bread to make our bacon, lettuce, egg, and tomato sandwich out of. That was the dietary change we made in 1971. But it was a start. Anyway, I'd like to introduce you to Dr. Burkitt. This is the only video that exists of this man. And I took it in relationship to my television show, which I was the co-host of Lifestyle Magazine for 35 years, which is a TV show that still plays today, which went or maybe still does to 95% of the households around the world. So we filmed Dr. Burkitt, and as I say, I know of no other place that you can find a story of him. If you want to find a longer 1-hour discussion by Dr. Burkitt, you go to my website, and in my January 2013 newsletter, you'll find the complete discussion of diet by Dr. Burkitt. Let me just show you a couple segments.
If you look at the diet of disease of the countries throughout the world, who don't get the common diseases of Western culture. And when I say the common diseases, I mean diseases like atherosclerosis, diabetes, gallstones, bowel cancer, breast cancer, hemorrhoids, varicose veins, diverticular disease, huge pile of stuff. The countries who don't get these diseases have a diet with far more starch, far more fiber, far less fat, far less sugar, far less salt. And the two major things we need is to eat more fiber and less fat.
So did you see Dr. Burkett? He mentioned the word, when you listened, I almost feel like I should play it for you again. He mentioned starch. We used to call the food that I recommend the corn, the beans, the rice, the wheat, the sweet potatoes, the potatoes. We used to know that as starch. Back when your grandma was around, or your great grandma. That's what they do, is they talk about a starch you were having for dinner when you came over and visited. But in 1977, we had the dietary goals for the United States, which was headed by Senator George McGovern. Senator McGovern, he got together a select committee, and they looked at the nutritional information available that day. And they came to the conclusion that Americans, to be healthy, because they also came to the conclusion that our heart disease, diabetes, obesity, high blood pressure, et cetera, were due to what we ate. They came to the conclusion that we should drastically cut down on our intake of animal foods, of meats, of dairy. And what do you think happened? There was a revolt by the food industry. They sent their lobbyists, they spent their advertising dollars, their influence on Congress, to the point where this was in February of 1977. By the end of 1977, they'd completely changed the dietary goals for the United States and essentially wiped out recommendations that you should change your diet and get rid of the meat and dairy. And they changed the terminology, the nomenclature. They got rid of the words, so that you couldn't act. Like, for example, they would not refer to the problem causers as meat and dairy. They talked about it as high cholesterol, high saturated fat foods. Well, how do you relate? Oh, there's some cholesterol on my plate. Nothing. And they taught us to not call starch anymore. They taught us to call it complex carbohydrate. I mean, how many of you this summer can go out to your garden and identify the complex carbohydrates in your garden? It's called starch. All right. Anyway, they've got the words, and they have succeeded without hardly any interference up to date. They still dominate the dietary guidelines for the United States that are published every 5 years. Industry wins. Agribusiness, which is controlled by the United States Department of Agriculture, the same governmental department that gives you recommendations on how to be healthy, conflicting goals, agribusiness and you, agribusiness wins in that department because they got the money. It hasn't changed in the United States. It has changed in Canada, though. As of 2019, the Canadian dietary guidelines no longer favor the meat and the dairy industry. So there's hope. There's hope. Anyway, let's go back to that lecture, the famous lecture that I heard in December of 1971. I mentioned that Dennis Burkett took his buddies, Clive Walker, and a couple others along with him to Africa. And Walker was one of his best friends. And he showed this slide. And I similar to this slide. This is not the exact slide. This is from my best of memory. And it's a real education, the whole slide here. You see on one side of the slide, you've got this big hospital. And the other side of the slide, that's this side of the slide, the other frame, right next to the hospital, you have these tiny little rock hard bowel movements. Okay. And so his message was, in populations that have tiny rock hard bowel movements, you need big hospitals. And then on this side, in contrast, you see populations that have big bowel movements, they have little hospitals. Yeah, I hope that makes sense to you. It certainly made sense to me. Anyway, they spent a lot of time interested in bowel movements, and so especially his friend Walker.
Well, you see, I spent years recognizing that fiber related to bowel behavior, recognizing that in people who had adequate bowel behavior, they virtually never had a lot of our Western diseases. And I really copied the example of my friend Alec Walker in South Africa, who has looked at thousands of stools. But you see, now we know from the evidence available that the average American who isn't a vegetarian only passes about 80 to 130 grams of stool a day. In people and elderly people under 50. Whereas in countries who don't get bowel cancer, breast cancer, gallstones, coronary heart disease, so on, they pass 3 to 500 grams of stool a day. And I think we are genetically, as it were, coded or made to get on with far more fiber than we take. And I think our relationship to, well, there was always causative relationship, but our relationship to a lot of our Western diseases is related to what I might call our national constipation.
All right. So that's what I learned back in 1971, and that's what changed my life forever. It took me only a few more years. I had to become a surgical intern, and I went on to study to become a board-certified internist. And then Mary and I spent 3 years as on a sugar plantation. Many of you know that story, which was another major thing that happened in my life. Was I took care of 5,000 people on a sugar plantation on the Big Island of Hawaii, and that's where I really learned how to practice medicine. And then after I returned to Oahu, I worked in Kailua, I set up a general practice, and I don't have any hesitation admitting to you, I had to chase ambulances. I had to hang out in emergency rooms just to find enough disease to put shoes on the kids. And that happened between 1978 and 1985. In 1985, I had enough following that I no longer had to see people who weren't interested in what I was interested in. By then, I'd had a radio show that played every Sunday night all over the Hawaiian Islands. I'd become quite famous in magazines and legislation I was involved in, like getting a law passed on informed consent so that the people of Hawaii, the women in Hawaii, had a chance when it came to breast cancer. Anyway, I had a reputation. I can't say I was popular among my colleagues, but the general population seemed to like what I had to say. And so I was able to give up my beeper and stop working after 5 o'clock in the afternoon, and only see people who wanted to see me as of 1985. The diseases that are related to constipation are many, and I'd like to go through a few with you. When you have the rock hard fecal marbles, I hope that those words strung together in the name that I call the American stool, the rock hard fecal marble. I know for many of you, you can relate. What we're talking about is the food going through the small intestine. Now remember, small intestine absorbs everything except for non-digestible fiber. Okay? So all the vitamins, all the minerals, all the proteins, all the fats, all the carbohydrates are absorbed in the small intestine. And when you get to the large intestine, which is right here, this is the small intestine ending, the large intestine right here, there's hardly anything left. There's some dead cells. There's a little dietary fiber that you might have in the foods that you choose. Not much, maybe 8 grams, maybe 10 grams a day. And you don't have much to make a bowel movement out of. So you make these little rock hard stools. And to get to that particular form and hardness, what happens is the stool is moved up the ascending colon, and in the process, water is taken out of the stool. It becomes dehydrated. All right. So to get it to move through the intestinal tract, it does so by a process called peristalsis, which means squeezing of the organ like this. Okay. So it rhythmically squeezes. And when you squeeze a hollow organ like this at large diameters, you create small pressures. When you squeeze at small diameters, you create large pressures. It's called the law of Laplace. Okay, it's a law of physics, and it applies, applies all over science. So you're squeezing small diameters because you have these tiny little rock hard stools, and as a result, you create these very high pressures. And what happens with these high pressures is you blow out little balloons. And these little balloons that you blow out through the intestinal tract are known as diverticuli. And as a result, you get diverticular disease, which is primarily manifested as bleeding. And you get diverticulitis, which is often referred to as left-sided appendicitis. In other words, you get infection of these, and it's just like having your appendix infected. The bleeding can become so severe. I can remember being in operations, surgeries, where the only way we could save the patient's life was to take a whole section of their bowel out because they were bleeding to death from diverticuli. The interesting thing is, even back then, when I was a surgical intern back in 1972, there was research published that showed that if you have patients that have diverticular disease and you put them on a low fiber or high fiber diet, just adding like wheat bran to their program, you would stop the bleeding and stop the recurrent infections. And so people who have these diverticular problems, the balloons aren't going to go away unless you surgically remove them. But you can stop them from getting infected. You can stop them from bleeding by eating a high fiber diet. Now remember, fiber is only in vegetable foods. Okay, that's the clue. So where are you going to find fiber? In your starches, vegetables, and fruits. Your beans and your corn and your rice, and your potatoes, and your sweet potatoes. So if you start eating those foods, then you'll stop having the recurrent bleeding and the recurrent infection. We know that 40, 50 years ago. Still know it today. Anyway, so that's what happens as you get these diverticuli. And how many people have these diverticular problems? Oh, somewhere between 40 and 50% of Americans by the time they get to be 50 years old and older. Most of the time it doesn't bother them, so they don't even notice it. All right, you see right here? You see this one, this diverticuli? You see a little fecal marble stuck in it. You see that it lies right next to a blood vessel. Okay, the blood vessel circulation to the bowel, it courses the outside of the intestine, the outside wall, and then it dives through the intestinal wall, and then it courses the inside of the intestine, and that's how the whole intestine gets its blood supply, by these vessels. Well, where the blood vessel penetrates through the muscular wall is the weakest part of the intestine. So that's where you get the diverticuli, is right in this weakness area. That's why there's so much bleeding problems, is because the blood vessel lies right next to it. All right. So anyway, you've got the tiny rock hard fecal marble. You got it all the way moved down to the sigmoid intestine, that last part, the S, and into the rectum. And now you got to get it to see fresh air. And that's a chore. I mean, a typical American diet, I don't know of any studies that have ever timed it. I should have put that in the book. Maybe I should look for it. But, just for my memory's sake, just from the patients I've talked to, we're talking about a job that lasts, 10, 15, 30 minutes, once every 4 or 5 days. And of course, one of the side effects of the McDougall diet is instantaneous gratification. At the Flamingo Resort, where we used to run our program, we ran it for 18 years. They always planned ahead when they knew a McDougall program was coming in. They always ordered extra toilet paper. Anyway, you gotta get that big little rock hard mass to come out, and you do that by grunting and groaning and straining. And the best way to depict that that pressure that you put throughout the body is, to recall, we're looking at a red-faced person, because blood is being pushed up into their face through the grunting, groaning, and straining. Well, by the way, I want to add, it's a whole discussion on dairy that I've given many of you. Another cause of constipation that's really important is dairy products. In fact, this is one of the more important causes of constipation, particularly in kids, is the dairy protein paralyzes the bowel wall. The bowel wall becomes inflamed, and it stops its motility. And so in a study that I showed you from the New England Journal of Medicine in 1998, I showed you where they took severely constipated children. How'd you get into the study? Well, you had to have a bowel movement every 3 to 15 days with the use of a laxative. That's how they picked their subjects. And they took them off the cow's milk, and they put them on soy milk, and 70% of them were cured overnight, almost overnight. And then 8 to 12 months later, they asked the parents to put the kids back on cow's milk. And within 5 to 7 days, all the kids were severely constipated. In other words, they had a bowel movement every 3 to 15 days with a laxative. So if you're having adults or children who have problems with constipation, you got to get the low-fat dairy out. You got to get that dairy protein out of your diet. All right, well, let's get back to the grunting, groaning, and straining here for a minute. When you grunt, groan, and strain, it's not just pushing blood into your face. You push blood all over your body, and you damage the veins throughout the body. Like, for example, these veins right here. These veins right here these are called the hemorrhoidal veins. Okay, they're at the last part of the intestine. They're in an area we refer to as the anus. And this is an internal hemorrhoid. This is an external hemorrhoid. Okay, there's a little band that separates the two if you need to know. And the way that these things get dilated out is you grunt and groan and strain, and you put excessive pressure on these veins, and they stretch. And through years of stretching, they eventually hang outside your butt. Those are hemorrhoids. These are difficult. I mean, you're cumbersome. The bowel movement time, and they bleed and they itch, and they're trying. I don't want to get too personal, but they're not very attractive either. So you get these hemorrhoids, and they're there permanently. You can't change this. This is mechanical damage. You can have them operated on. You can have them tied off with strings, or lasers will cut them off. But they're not going to go away. I don't care if you change your diet or not. The nice thing is, if you change their diet, they stop bleeding and they stop itching. And they're much easier to live with. When you grunt and groan and strain, you push blood into your legs. Now, the legs are interesting in the sense that you have your toes here. Okay, you have your toes here. To go from your toe all the way up to your heart, this is a vein, all right? Big vein, huge vein. And it carries blood from your feet back to your heart. And the way it moves the blood is through a mechanical compression that occurs when you walk. The muscles contract, and they push on the blood vessels, and they move the blood up the heart, up like this, okay? But to keep the blood from falling back down to the feet, you have valves. These are the valves right here. So the blood gets pushed up, tries to fall back down to the feet, doesn't work out. Muscle contraction occurs, push it up to the next one, etc. All right, this is a 5-foot column of blood. This is a tremendous amount of pressure you're working against. So you have these valves, and what happens when you grunt and groan and strain is you put pressure on these valves, and you stretch them out, you dilate them, and they become incompetent. And now what happens is you have this whole column of blood on this large blood vessel, or even smaller blood vessels, and it's called varicose veins. Okay, this is how you get varicose veins. You don't get them from being pregnant, alone. You got to be constipated and pregnant. You get it from grunting, groaning, and straining. All right, and then you get clots in these veins sometimes, and that's deep vein thrombosis, and those clots can sometimes go to your lung, cause pulmonary emboli, and they could kill you. And by the way, you only have pulmonary emboli and deep vein deep vein clotting problems when you eat the American diet for a whole bunch of reasons. And I don't have time to go into them right now, but there are a lot of the mechanisms have worked out. And when you grunt and groan and strain as a woman, you've got your uterus here when you're a young woman up in the pelvis. And it's suspended by these ligaments. All right. And what happens when you grunt and groan and strain is you push on your uterus, and it pushes the uterus down into the vagina. And these ligaments become stretched out. And it's this a permanent situation. And you end up with your uterus in your vagina. It's called a prolapsed uterus. And sometimes, in fact, often, the uterus actually will hang out of the body. This is troublesome. It's not going to go back. Okay? It's not going to go back by eating a good diet. If you need to have it fixed, it has to be a surgical procedure. And with men, what happens when you grunt and groan and strain is you dilate the veins in the scrotum, and you get something, you get varicocele, they're called, and you dilate other types of tubular structures in the scrotum, and you get varicocele, we call them. So men are not immune from the problems of excess pressure caused by constipation. All right. Well, when you grunt and groan and strain, you also push the stomach. This is important. Let's take a minute to go through this. Here's our patient here, and he's got the chest cavity where the lungs sit, and then he's got the abdominal cavity where the intestines and the liver and the spleen and so on sit. And between the two, you have the diaphragm right here. All right. Now, there are 3 tubes that must pass from the chest cavity and the abdominal cavity. 2 of them are immobile. They're the vena cava and the aorta. They're stuck. They're stuck against the walls of these cavities, and so they'll move. But the 3rd tube is the esophagus, and it's mobile. And so when you grunt and groan and strain, you can move this esophagus. And what happens is grunting and groaning and straining pushes on the stomach primarily, and pushes the parts of the stomach up into the chest cavity. Well, this is the lower esophageal sphincter right here that you see on the left side. And that's competent when you're a young person. But through years of constipation, what happens is the lower esophageal sphincter becomes incompetent, and you get GERD, gastroesophageal reflux disease, right? Okay, so now the sphincter lies up in the chest, where it's not supported by the diaphragm anymore, so it becomes incompetent. And with every breath you take, you create negative pressures in the chest, which sucks the acid up into your esophagus. It's not going to go away by eating a good diet, but the indigestion goes away. And you usually don't have to have anything done, but you can, because it's a mechanical problem. Guess what you do? You go to the surgeon and you get a mechanical fix. Lots of surgeons would be glad to take and cut your hemorrhoids out and your varicose veins out. Oh, good grief, don't let them do it. Unless you have to, figure out some way to live with these problems. But if you can't, they're always there to help you. All right. So let's get to the end of this story. I started out talking about bad breath and body odor and how it's a sulfur that stinks, and how there are mouthwashes actually that deactivate sulfur, and they become very popular. They're called smart mouthwashes. You'll see them on your cable shows because they're such a big deal, because finally they really deal with the stink, which is the sulfur. But the best way to deal with this stink, the body odor, the halitosis, bad breath, is to stop eating the sulfur. And as I explained to you in our last lecture, and I'll go over it again, is that you get the sulfur from the food. Like beef has 4 times more sulfur than pinto beans. Same amount of calories, same amount of protein. 4 times more sulfur containing amino acids. Eggs 4 times more than corn, cheddar cheese 5 times more than white potatoes, chicken 7 times more than rice, and tuna 12 times more than sweet potatoes. All right. Cutting the cheese. We got a saying in Michigan, every time I try it to see if I get a reaction, nobody can relate to it, but I'll try it again with you folks. It's called fish farts. I don't know whether you've ever heard of that. Anyway, that used to be something that was in our neighborhood we talked about. Maybe because I lived in a Catholic neighborhood, we used to have fish Fridays. So it became noticeable on Saturday and Sunday. Anyway, if you want to get rid of the stink, you want to stop smelling bad, because you're not going to cover it up. You're not going to cover it with perfumes or deodorants or mouthwashes, brushing your teeth. I don't care how many times you brush your teeth. If you want to get rid of the stink, what you got to do is stop eating the sulfur. Isn't this getting repetitious? Aren't you tired of the same broken record? You know, all the way from heart disease to baldness to constipation to toe. Well, let's not go so far as toe fungus. Let's go as far as toe fungus. I mean, everything has to do with the food. But if you were a farmer, what would you think? Don't you think everything has to do with the soil? I mean, if you start out with bad soil, what chance do you have? Same thing with you. If you're going to start out with your family with bad soil, what chance do you have? So, you know, you want to fix your problems, you got to fix the cause. It's the food. So Larry and Louise would like to say goodbye. Anyway, bye. Okay. Anyway, you might enjoy this book. It's a lot of fun. It's a good reference for you. All the scientific references you'll ever need are there, including a whole discussion on why we're essentially plant eaters. We're herbivores. It goes through all the way from your teeth to your lack of fangs, you know, to your saliva in your mouth and your seminal vesicles and your prostate gland, and you know, everything. It talks all about that stuff, why you are clearly an herbivore. And people like to argue with their carnivorous friends, you know, why we're not omnivores. We're not omnivores, we're herbivores. Anyway, it's the digestive tune-up. And what we do these days is we teach the program by the internet. And I've had a chance to talk about it when we talked to Bethany at the beginning of this lecture. And that's the best way to learn. And not that you can't learn other ways. Many of you have learned for free. You've gotten books at the used bookstore for 50 cents or less. Or you've just gone onto the website. The website tells you everything you need to do for free. But it's hard. You know, I mean, it must be hard because everybody's not doing it. So you also may need some medical supervision. We got to get you off the drugs. And that's what we do. We get nearly 90% of people off their medications. And you need support to at least get started. You need some direction. You need a few recipes to carry you through until you find more recipes. And we have at least 4,000 published recipes. So we run this almost every month. We didn't run one this June, but we're running one in July 8th through 19th. And that's a 12-day course where Dr. Lim will start with you. And Dr. Lim will do a thorough history exam with you and give you some really good advice. And occasionally shares some of the more difficult problems with me. And I kind of butt in a little bit. And then where, you know, every day, Corey, Tiffany, or Stacy, they get together with you all day long, starting out in the morning. That's who else. There's just a support person. They help you in the kitchen with your breakfast, lunch, and dinner if you need. And they talk to you about your blood pressure and your blood sugar and how you're doing. And so it's really helpful. Like I said, we try to make the program as personal as possible. Every day, Mary and I and Heather, we get together with you for a fireside chat, which gives me a chance to talk to people in a little less personal, a little less professional manner. You know, we talk about what we eat and things that are important to us in our lives at that particular moment. And then, of course, we have that very special session where you get together with each other and get, you know, people who have met each other on the, during the 12-day program, they become friends for life. You know, we facilitate that. We make it available so that you can get together with your group every Wednesday, and you can talk to them. And there's nothing like the support from your fellow travelers. So next program, July 8th through 19th, we run on every month, and life's short, folks. You know, and you're going to look back and you say, why didn't I do this before? You know, if it was so darn important, it was so darn easy, why didn't I do this before? It's the way it is with everything in life, and this is a good thing. So you just get in touch with us either by the 800 number or give us an email. We'll get you started painlessly. It really is. All right. Well, did you learn more than you want to know about your bowels?
I love that. If
Yeah.
you pass large stools, if you pass small stools, you need large hospitals.
Yeah. Well, I learned a lot of things from my mentors. And I've talked to you about how I have basically 4 mentors that I stand on their shoulders. And these are really geniuses. And I've known them personally, and I've known about their marital situation and the support they've had in their lives and whether they had it or not. And all 4 of them were missing the secret ingredient that I have, which really makes the program work, which makes it practical, makes it friendly, makes it enjoyable. And my secret ingredient, I'd like to introduce you to my secret ingredient over there.
Your secret ingredient.
Secret ingredient, my special thing that makes me have an advantage over anybody that's ever tried to do this before. And that's Mary. And I'd like to invite her over to talk to you and see if you have any questions.
Well, we do have, whenever you come on, Dr. McDougall, we have lots of questions, but I think we should answer the ones that were specifically sent in about the topic, don't you, GI?
Yeah, let's start with that. But yeah, it'll take Mary a couple seconds to go over here.
And it's interesting.
What?
Want to answer the questions first?
Well, I'd like to have you in the frame because you improve everything so much. You make me look better.
She's probably heard you speak so many times. She could probably answer some of them.
Yeah, she tells me.
Probably.
She tells me she never gets tired of listening to me.
Okay.
Anyway.
All right, you guys.
Look, we started match, right?
I was going to say, once again, you guys have color coordinated yourselves. So that's amazing. It's interesting, Dr. McDougall, while you were giving the talk, I was watching the chat and a couple people said, you mean there's fiber in starch?
Well, that's the only place you find fibers in plants.
But people don't seem to know that. Some people.
I know they think it's like a bristles of a broom. They think it scratches your intestine. And that's why I ask you to think about taking a baked potato and thoroughly baking it, and then just, taking the insides, the white of the potato, and put it in a glass of water and take a fork and stir it up. What do you got?
Where do they think fiber comes from?
I mean,
where else would you get fiber?
Mary, I was in a discussion with a dietitian several years back, and she criticized me publicly because I didn't know there was fiber in meat. She said, that grizzly stuff.
That's fiber?
No, it's not.
Well, I know it's not, but I mean, that's what she said.
She said that's what she thought fiber was that, that grizzle that you find in the muscle, which is really tendons. She thought that was fiber. This is a registered dietitian. Yeah, I know. No, fiber, you have glucose sugars, which are 5-carbon sugars, and they're attached in long chains. They form long chains called amylose and amylopectin. If they're branched, they're amylopectins. Okay, so they're long chains of these sugars, glucoses. Between each sugar, we can put a digestible, and our body does this. Plants do this. And our body breaks them down. And we can also put linkages that are digestible to form glycogen. Whole other story. But anyway, plants put in their linkages that we can digest. We have enzymes to digest. And so we call these chains starch. Amylose, amylopectin. And then we have the same sugars, glucose, that are attached with linkages that we don't have enzymes to digest. And those are called dietary fiber or non-digestible carbohydrates.
That's too confusing.
Well, how would you say it?
Well, I don't know. I mean, is there more fiber in brown rice than there is in white rice?
I have no idea, but there's plenty in all.
Because I would think that, the
Oh yeah, there is. That's an easy question.
Okay.
There's
well,
more.
then will there be more fiber in a potato that had skin on it than a potato that was?
I would guess so.
Okay. See, so I'm.
It's a good thing I added her to the conversation.
Well,
yeah,
I'm
right.
thinking maybe that's what people think about fiber is it's the part that.
The brown stuff.
Yeah, the brown stuff. Or,
Okay,
the peels of an apple.
That's okay. Yeah, you can think about it that way. As I remember, there is more fiber in them.
Okay.
But I don't want you to miss the fact that there's plenty of fiber in the internal part.
Okay.
In the white rice, there's
Well,
some
I
fiber.
believe that. I was just,
Thank you, Mary.
pointing.
Let's just have Mary answer the questions. She
Well,
knows.
I'm just about ready to leave, so don't threaten.
I'm just kidding.
You
Yeah.
won't be calling me his better half anymore after a while.
We've had 50 great years, and it's never been boring.
That's great. Okay, so we're going to start with the GI questions, and thank you guys for sending them in advance. Whenever Dr. McDougall, really any doctors on, we do need to get them in advance. And this is from Renee. Could you please ask Dr. McDougall if he has advice for someone with a redundant colon? I've been whole food plant-based since 8/21, but still have occasional slow movements or mild blockages. I also take magnesium supplements to help keep things moving.
Right. Well, magnesium is a bowel stimulant. And, milk and magnesia people commonly buy. And whereas calcium, like Tums, is constipating, magnesium has the opposite effect on the bowel. So I don't see any reason not to take the magnesium to help with the bowels, but I see reasons not to take it in general. And that is magnesium has been associated with an increased risk of heart disease, heart surgery, heart attacks, all kinds of heart problems. So I think that I as a general advice, I would not take that approach to take magnesium. But then again, it's probably the safest of all of the laxatives you're going to take, or one of the safest. As far as the redundant colon, it can get so bad that we call it a megacolon. And especially happens in kids that just don't have a bowel movement, because of their food. I mean, you can't not have a good bowel movement if you feed your child the right food. So they have an unhealthy meal plan that has low fiber, white bread,
Okay.
low fiber, but not white potatoes. I think the white potatoes are good.
All right.
And so they have, and they have the dairy that paralyzes the bowel wall. And they end up getting something called a megacolon, and you take a picture of their abdomen, and you see this ball is so large it fills up half of their abdomen. And this ball, when it gets stretched out to this size, gets what we call a floppy. It doesn't have strength to it anymore. And then, of course, you need some kind of laxative to artificially stimulate it. But that's not what you want to do. What you want to do is you want to get the ball small again. So you've got to train it. And this is a muscle. The bowel wall is made of muscle. So the way you train muscle is you exercise it. And when you exercise it with putting high fiber foods in, that's usually enough. But sometimes it's not. And I've had a situation where the basic diet that we recommend is not enough to get really lazy bowels working like it should. And what I used is a non-digestible sugar called lactulose, or cronulax, another name for it, lactulose. And this is doctor prescribed, non-toxic, doesn't leave the intestinal tract, doesn't go into the body. And what it does is it drags water in and makes a very, very voluminous content of the last part of the large intestine.
So it's like adding more fiber?
It's like adding more fiber, but yeah, that'd be a good thought, yeah. Just like, fiber sugar.
Yeah, okay.
But you buy this in a bottle
Yeah,
and you take it as a tablespoon.
I realize that. Yes.
Yeah, and what we do is we train the bowel, and this is a long-term process. So from the little bit I know about this caller, what I would say is that you should put more focus on training your bowel. See if you can get the magnesium supplements down. And I realize that right now it might be the only thing that gives you relief. And instead you approach it from fiber point of view. And there are lots of fiber pills you can buy. There's just tons of them. I don't know that you can buy different types of fiber. You can find them on the internet. And
they're mostly safe.
Yeah, they're safe. You may get big bowel movements when you take these things. But you also want to start out with a basic high fiber diet. And what's that? Well, a diet without animal foods. That's starch-based with fruits and vegetables. Then you want to add some of these fiber supplements. You know any names of these fiber supplements, Smarty?
Metamucil?
Relax.
Oh,
I'm thinking of like Swiss Chris and Senna.
Yeah, that's right.
SENNA.
Yeah.
And Prunelax or Prunelax.
Then you get some prune effects too. You get stimulus from the prunes. Anyway, that's
And then
what,
you can always think about prune juice, don't you? I mean, you have these jokes about old people buying prune juice to get their bowels moving.
Isn't there a joke? You take it in the PM for a BM in the AM?
Yeah.
that's good.
So, Dr. McDougall, is a tortuous colon the same as a redundant colon? Because the next person has a question on a tortuous colon.
I think so. I think we're both talking about the same thing. We're talking about more colon than the usual person has. In one case, it may be dominantly a mega large colon. The other case, it's elongated and it's
Why does it get that way?
chronic constipation.
Oh, okay.
I imagine there are some people who are born with more intestines than say the average person, and it might become more tortuous.
All right.
But I would think that if this has become aware to the patient's awareness that it's because this is troublesome, and then I would start thinking about the same thing that would be called a floppy colon.
Okay.
That's another way to
So
refer to
there's
it.
all kinds of names for it.
Yeah, but it's all basically the same. It's a lazy bowel, lazy colon. That's what it is.
Does
Lazy
anything like
bowel. You need to train
exercise
that
help?
guy.
Could exercise help or pelvic floor physical therapy?
Well, I'm talking about exercising the bowel muscle, not the legs and the arms. I can't imagine it would. Although people say that, exercise helps.
Yeah, I can think of some yoga poses that might
Yeah.
Be good for the bowels.
It can't hurt.
Yeah.
Yeah. So
Okay.
if you exercise carefully.
Here's a question. I can't find the name because they didn't give the name, just their email. But anyway, Pilar, actually, recurrent intestinal obstructions. My doctor put me on a low fiber diet by eating only cooked and peeled vegetables, and I get very constipated. Does eating raw fiber like salads cause intestinal obstructions?
Well, I have people who have they have intermittent bowel obstruction due to, say, scar tissue that's in the intestinal tract. And they're often recommended a very low fiber diet, but that's not the way I treat them. And I've been taking care of these problems for over 40 years.
Yeah, but there would be fiber in cooked vegetables anyway, wouldn't there?
There would, but you see, they're trying to teach somebody that there's too much fiber in the peel, or don't eat celery,
Yeah.
or don't eat pea pods, that kind of
Okay.
thing. But that's just the opposite of what they should be doing. These people often have intermittent bowel obstruction, and so gets so bad that the abdominal cavity swells up and they have to go into the hospital, and they put a nasogastric tube down their nose, and they kind of relieve the thing from the top end. And then they'll typically prescribe for them a low fiber diet. And that's not what they should do. What they should do is they should follow a high fiber diet. And if you're worried about, say, stringy vegetables, even though it hasn't been my experience to eat celery, or what did we have last night over Craig's house that was pretty stringy? Bok choy?
Bok choy and Chinese broccoli leaves.
Boy, I tell you, some of that stuff I'd have to bring it to a cow to eat it. It's pretty firm. But if you're worried about that might be a problem, just take your blender and grind it up. Grind up things that you think might be troublesome. And again, it's microscopic sugars you're talking about. So, you disrupt some of the fiber for sure.
But it's still there.
It's still there. It's just all broken up little pieces.
Yeah, but does it still work?
Still works, but
Okay.
not as well as it did when it was intact.
All right. But then they're talking about, they're almost making it sound like if you eat salads and raw vegetables, that there's more fiber there.
Yeah, and they think that it'll get stuck. See, they got this
okay.
intermittent bowel obstruction. They think that, and it's a result of, say, they've had radiation of their intestinal tract, or they had Crohn's disease. And as a result, they do really have narrowings of their bowel. And so they get intermittent bowel obstruction. In other words, every few weeks or months or so on, they end up, they can't, the belly becomes swollen. They can't have a bowel movement. They go into the hospital and they put a nasogastric tube down their nose and suck them out and let them relax, rest a little bit, and then it kind of opens up.
No.
But the way that my experience has been that I put them on a high fiber diet. And let's just say, if you think that there's going to be a problem with things like pea pods and celery and apple peels, then just stick them in a blender and grind them up, and then you won't even have to worry about it. Then, your mother-in-law won't have to worry about it, neither will your doctor. Remember that fiber is not bristles of a broom. It's microscopic. And those kind of things don't get stuck in a partial obstruction.
Yeah. And isn't fiber really also the secret to weight loss?
Well, it helps because it doesn't have any calories. That's why it's pushed. But, AJ is, people are told, and it gets popular. It's kind of cyclic how things get popular. People are sold high fiber approaches, so they buy fiber pills. And what happens is they take them, and yes, the fiber fills up the stomach, but they don't get any sense of satisfaction. And what you need is the sugar, the carbohydrate, which satisfies the hunger drive. And when I say sugar, I'm talking about beans and corn and potatoes and rice, not table sugar. There's a low fiber food, table sugar.
It's white too.
Yeah, it's white too. There's no fiber at all, table sugar. Rot your teeth too.
Well, I'm sure you told them the story about Dennis Burkitt and the whole wheat bread and the white bread. So obviously there's more fiber in whole wheat bread than there is in white bread.
I told them we changed our diet.
Yeah. We ate whole wheat bread instead of white bread.
Yeah, that with our bacon and eggs.
Yeah.
So yeah, I told them that.
Oh, that's funny with your bacon and eggs. Anne wants to know if a person.
We all started someplace. Chef AJ, we started. People who know me understand that I do things with great enthusiasm. So I almost killed myself during my first 20 years of life. I had a stroke and I was 90 pounds heavier than I am now. And, I was dying because I ate what my parents taught me I was supposed to eat because they were worried about me having calcium and protein deficiency. So I was in no risk of getting pizza deficiency or sirloin steak
really
deficiency.
Eat that much badly than anyone else? Or was it
I don't
just
think so.
No, it was the same as everybody else was eating. Yeah.
Well, maybe I did it with a little more enthusiasm.
Yeah. There were times when we first got married when I kind of objected to the kind of breakfast that he wanted me to make him.
Yeah, I know.
I grew up on cereals for breakfast and he grew up on bacon and eggs.
Yeah. No, I would say you'd find probably 25% of males, they'd be in competition with me at the dinner table. But it depends on how you were raised. You were raised in different kinds of families. Like Mary, her typical meals for her family were casseroles. For mine, it was a glob of meat and some eggs and cheese, and that was it. So a whole different style of cooking. And when we got married, unfortunately, she won out. But anyway, it was a transition for us. You probably heard me tell this story. When I became a sugar plantation doctor, we stopped eating feedlot beef. We started eating range beef. And
I can still remember how weird it tasted.
Oh, yeah. And then we got used to it.
Yeah.
Then we thought the grazed beef was really yucky.
Yeah.
And we started eating brown bread. And that was a major change we made in our diet. That was a big deal. That was for at least 2 years while I worked as a sugar plantation doctor between 1973 and 1976. So, and then we changed. By 1977, we were pretty much pure vegan. Have been ever since.
Did you say 1977?
Yeah.
That's the exact year I went vegan, 45 years ago.
Really?
Yeah.
Wow.
Well, that's probably why we're still alive.
That's funny. Dr. McDougall, Anne has a question about if you don't have a gallbladder, is it necessary to take bile supplements?
No, it's not necessary to take bile supplements. And what you need to do is see if you don't have your gallbladder, then you don't have the storage sac for the bile that's made by the liver. See, the liver is making bile all the time. And part of the reason for bile is to make bile acids, which digest fat. The other part of bile is it picks up a whole bunch of chemicals and dead blood cells and stuff, and it kind of filters the circulatory system out. So you make this bile, and one of its jobs, like I say, it has bile acids in them, and bile acids degrade fat, so it becomes digestible. All right, so you make the bile acids in the liver, and then they come out of this common bile duct, And what happens between meals, and most people who have their gallbladder, is a little sphincter right at where the bile duct enters the small intestine. It's called the sphincter of Oddi, ODI. And that sphincter closes down, and the bile backs up into this sac. This sac is the gallbladder. Now, say you lost your gallbladder, which is 30-40% of women who are older than 40, they've lost their gallbladder, at least in older times. That was the data. So now you have no storage sac. So now what happens, still there's bile made. You don't have to take any bile. But what happens is the bile ends up in the intestine all the time because there's no place for storing it. It used to be stored between meals. And then when the meal came along, the gallbladder contracted and sphincter of Oddi opened up. And you squirted bile onto your food. So does taking bile help you feel better in any way? I'll tell you the downside of taking bile is that bile is irritating, and it causes diarrhea, especially if you take it in sufficient quantities. And the other thing is, because it's irritating, it increases the risk of right-sided colon cancer. In other words, cancer in the ascending colon that I showed you.
That's so funny that you said that, because she said associated with a risk of right-sided colon cancer. So she wanted to know if there are additional tests you recommend for colorectal cancer screening.
No, one of the sad things is that and this is in my August 2010 newsletter, if you want to find the discussion, is that when you take polyps or small cancers out of the large intestine, there's only a survival benefit shown in those that are taken out of the descending, the last part of the large intestine. When you take polyps or early cancers out of the right side or the ascending colon.
Isn't that called the small intestine too?
Well, then you got to go a little further into small intestine.
Oh, okay.
So you go ascending, transverse, descending, sigmoid, rectum, anus.
Yeah, but I thought the ascending was the small intestine.
No, that's way ascending. That's,
Okay.
that's ascending past ascending.
That's the little curly cues in the middle, right?
You guys should do a little comedy act together. Great.
So anyway, when you take the tumors out of the ascending or the right-sided colon, there's no survival benefit. Besides that, I don't believe in colonoscopies as a screening test. At most, I would recommend you get a sigmoid exam, which can look at the part of the intestine where we're removing the polyps, will reduce your risk of dying of colon cancer. That's it. Not overall risk of dying, but just the risk of dying of colon cancer. So I do recommend a sigmoid done between about age 55 to 75 years old, or to check your stool for, well, you can either check it for genetic material, which is a Cologuard test for $600, or you can do a stool for blood. And that kind of testing is done in several ways. That kind of testing costs you like $3, $40, that kind of thing. And nothing harmful at all. Neither does the sigmoid exam have any harm. Whereas a colonoscopy is a big deal. People die. And you got to be careful about agreeing to that test. In fact, I strongly recommend people don't, as a screening test. What should she do to prevent right-sided colon cancer? Okay, when you eat a low-fat diet, you don't stimulate the liver to make bile acids. Remember, bile acids digest the fats. So if you don't eat fat, then you don't make the bile acids. So you cut way down on your bile acid production, plus the fiber that's present in the vegetable foods. Remember, only vegetable foods have fiber. The fiber grabs a hold of the bile acids and inactivates them. So you decrease the risk of right-sided colon cancer just by changing your diet. It's another one of those things like, gee, it would have been nice if you wouldn't have lost your gallbladder, but you did. It's not going to grow back. Nobody's going to put it back. So what do you got to do to maximize your quality of life and minimize your risk of getting problems? You eat the same old diet that Dr. McDougall has been trying to get you to eat for 50 years. So, yeah, you guys got to do this, But,
so when the person is missing a gallbladder, should they be on a no overt fat diet?
You should be on a no fat diet if you're missing your little toe.
Well, but we get criticized for that because they say we're going to get dementia if we don't have a lot of fat.
Oh yeah, well we went through that a couple.
I know, but
lectures
I get emails every day.
Yeah, I know. You know, I got a new lecture series coming out. Heather and I are just finishing it up. It's on aging and dementia, and there's a section in there. It's really a really interesting, well worthwhile lecture. And we're not going to, you know, it's a package, and so Heather's selling it through the program. And you're going to be amazed at how much it teaches you and how much work that I put into it.
Oh, that's for sure.
All right.
Mary, you're on fire today. You're hilarious.
Well, she has to put up with me every day of trying to refining this lecture. I've been working on it for several months. So we're going to have that as a part of a new package on attractiveness and aging. And that comes out hopefully in the next 2 weeks. But anyway, one of the sections I talk about is the idea that eating essential fatty acids, DHA, EPA, is going to reduce your risk of getting Alzheimer's. And I show you the review articles, which you had there, AJ. I gave them to you to pass out to people. You know, it was a couple of lectures ago. I don't know if you can grab hold of them right away, but I gave you these lectures, these reviews that show that this is nonsense. It's not been shown to be beneficial, even though, you know, especially those supplement sellers, you know, the snake oil sellers, they try and take you to buy this stuff. The other thing I have a little section on is Pravagen. You know, you turn on cable TV, memory's gone. Everybody's losing their memory.
Oh, Nariva. Nariva is the other one.
Oh, that's another one. So I haven't done anything on that yet. But Pravagen, I looked up the business on Pravagen, and I put what I found in the new lecture. But there are some things that really do help your mind, and guess what? They turn out to be the same thing that helps your bowel movement. But I showed you all.
Maybe using it would work too.
Using your mind?
Yeah.
Yeah, I tell you another thing I found was kind of interesting. I was working on it this morning because it's actually in the news today. It's in USA Today, Barry.
Okay.
It's a paper you read a lot.
I read, yeah, so maybe I missed it.
It was in the life section, USA Today, or maybe the money section. It was about coffee.
Oh, I did read that.
Yeah. You like that, didn't you?
I like that.
Yeah. We like to hear good news about our bad habits. That's what people like to do. Anyway, it talks about how coffee reduces the risk of all kinds of diseases. Well, one of the things that
Not too much though.
Not too much coffee.
Not too much coffee.
Probably just as probably
just
more than you drink.
More than I drink.
That's the best. You know what a drunk is two more drinks than your doctor drinks, and it's anyway. So anyway, it actually talked about longevity. There's enough research to say that drinking coffee improves longevity. And by the way, they talked about 3 to 4 cups of coffee a day.
Well, and it wasn't the caffeine in the coffee.
No, it's the other alcohols.
The other things in the coffee.
So you can probably drink decaf if you want to. There's problems with decaf too. I don't think you should start coffee as an overall tonic for good health. Anxiety, irritability, insomnia.
Yeah, but if you didn't have the caffeine, maybe you wouldn't get those.
Then you have problems of raising your cholesterol.
Oh, okay.
Yeah, remember that the alkaloids in coffee raise cholesterol, and they raise your blood pressure, and they cause horrible indigestion.
But I would say
even decaf coffee causes horrible acid indigestion.
Yeah, but don't you think that there are more coffee drinkers than are not coffee drinkers?
That's the most popular psychoactive drug in the world.
Yeah. Okay, so we're just telling people that coffee is not all terrible.
I'm not sure I'm saying that. You know, I'm the doctor here. I'm supposed to give them an unbiased opinion.
All right, you give them their unbiased opinion.
I know that, like, I had Dr. Kim Williams on, and he's a big fan of coffee, drinking several cups a day from what the research says.
Well, you know, it's a plant food. It's made from the beans. And the thing is the way we take it, it's a drug. You know, Starbucks is a drug pusher. So you got to realize that. And in the quantities and concentrations that we consume it, you know, there are 60 different plants that make caffeine. So you don't have to pick coffee, as Mary was saying. There are a whole bunch of other ways to get caffeine.
Like tea.
And, you know, in my experience, it's been you get a different kind of high. You're always looking for the high, right, folks? You get a different kind of high when you drink tea or you get caffeine from other sources than you do with coffee. So
So it must be the other alkaloids in the
yeah,
coffee
yeah.
that does it.
It does. So there's a lifelong project for you, is to figure out what kind of high you like from caffeine.
Dr. McDougall, I don't take any caffeine, so I shouldn't start, right? I mean, even though there's some benefits.
That's what I want. That's why I'm trying to neutralize her comments. No, you shouldn't. It's called a bad habit for a reason. In other words, all the advantages you get, I can lay down one disadvantage at least for every one advantage. So no, don't.
So the article about coffee being a good thing for your brain was probably written by a coffee drinker.
Definitely. People love to hear good news about their bad habits. Just like I recall they did an article in the San Francisco Chronicle a decade ago. Whole front page was about how chocolate was good for you. I bet they sold more editions of that newspaper than any other one.
Yeah.
Drunks. What do you hear about alcohol? Come on now. What do you hear about alcohol?
Well, I've never had a doctor that didn't drink that recommended alcohol.
Yeah. Well, I don't recommend alcohol.
Right. And what I'm saying is all the doctors that recommend alcohol drink alcohol.
They all drink alcohol.
They do. I'm sure they do. But the thing is that people love to hear good news about their bad habits, and you can take almost anything. You can paint whatever picture you want to feel good about it, and you got to be careful who you're listening to. Just like AJ, when you have a guest on the show who looks overweight, they're talking to you about good health. Remember, they probably are doing what they say that they're doing, and it results in the way they look. I run into that all the time. In fact, I was invited to an obesity conference several years back, and half the audience was obese. These are doctors. They're rich people. They can afford rich food. Half of them were obese. Half the presenters were obese. Who would ever listen to an obese doctor talking about losing weight? Or a drunk?
A lot of people.
So be careful who you're listening to, and because the biases, they're pretty hard to hide if you're listening carefully.
Yep. Okay, back to the gallbladder. This is from Sue. She doesn't have one, and she wants to know if she should continue taking digestive enzymes. Right now, she takes one made with ox bile powder, but there are also vegan ones. How do digestive enzyme works with a person that has no gallbladder?
I wouldn't prescribe it to somebody who would ask me to start, should they start bile acids or digestive enzymes? I wouldn't suggest they start them just for the sake of starting them. But if you said, look, I'm having problems, I think I'm having digestive problems, and I try this supplement, and my life is so much better, well, then take them. First of all, I don't have the answer for everything. And second of all, what you observe and appreciate is extremely important. And if your doctor's not listening to you, then you really should find another doctor. So that's the way I would base upon whether or not this person should continue the digestive enzymes or the bile acid supplement is, hey, what's better? And if you're not sure if it's better, then why don't you stop taking it for a while and see how things go, and then reintroduce it. You've got the perfect setup for an experimental study that applies to the most important person there is, and that's you. Just test it. And the results are almost immediate. You've heard me talk about you've got all kinds of folks that are making recommendations for you. Yeah, well, how long do you give them? Well, first decide, is it going to kill you? Second, decide whether you're going to be able to afford the time, money, and effort. And that if you can't, then don't do it. And then you say, okay, it fulfills the first criteria, and you decide you're going to test it. How long does it take before you ought to give up? 4 months. Most things work within a week. But 4 months, if it doesn't work for 4 months, you're wasting your money. So you're going to run into all kinds of quote experts that have helpful advice, particularly if you listen to AJ's show. She's got lots of diverse doctors and experts on, which is good, JJ. You want to have a whole bunch of opinions, but treat them fair. I'm telling you that you're going to get well eating potatoes and rice and corn and beans at no cost. It's good for the planet. The animals love it. And I'm going to tell you get better in a week. We run programs. Our programs are 10 and 12 days. 10 and 12 days. You know, we get the results that are published in the scientific literature in 10 or 12 days. You know, certainly if it hasn't worked in 4 months, give up on the McDougalls. Yeah.
Try somebody else.
Yeah, really. Go see somebody else.
But they have to give it an honest try.
Yeah, I know. You know, saying
you can't
that.
say, Mom, trying it and not really be doing it.
Well, you know, Mary, that goes back to, you know, a philosophy I've had since I started doing this. It was, again, I remind you, it's been a while, is that I can tolerate you coming back to me and saying, I understood what you said, but it's too hard for me to do, or for this reason or that reason, I couldn't do it. But I never wanted people to come back to me and say, I listened to what you said and it didn't work. You know, that'd be too hard for me. So that's why I'm kind of strict in what I recommend is, you know, I don't build in any compromises for you. You'll do your own cheating.
Because it always works if you do it right.
It always works if you do it. It's just like if you're smoking cigarettes and you're coughing all the time, guess what happens when you quit? If you're drunk and you're falling down all the time, guess what happens when you quit? You know, it's just plain simple. It works. So, you know, anyway, what we recommend to you, it doesn't cost anything. And just to remind you again, what we offer is a whole bunch of support. We've got a website with free program, free recipes. You got to be spending time, you know, encourage your family and friends to take advantage of what we put up there for free. You know, it's free. And we've got books, you know, 13 national best-selling books.
I heard you talking about the program. I mean, if people are really having trouble,
well,
the program is where to come.
You know, even if they're not, even if they just want to spend time with friendly people for 12 days. And, you know, it's amazing, Mary, how many people come to us and they say, you know, I'm still having this problem.
Yeah.
And my cholesterol hasn't come down, or I wasn't able to get off my blood pressure pills. And then we put them in the program. And we give them a little supervision, a little encouragement, and voila, I just dropped 40 points in my cholesterol. Wonder how that happened.
There's just one thing I wasn't doing right. And I thought I was doing so great.
And I usually figure it out. So, you know, I, of course, would encourage you for a whole bunch of reasons, and mainly because we really like to see you do well, to take advantage of the internet program. You can be in China. You can be in Sydney, Australia. You can be any place in the world and take it, and it's right on your schedule. You can be a busy housewife. You can be a business person working 6-8 hours a day, and we'll fit you in.
Nice. Well, there's a question. Who is going to ever take your place? You are the best doctor in the world, says Louis.
Oh, thank you. I don't plan.
He plans on being around for a while.
That's right.
And I plan on keeping him for a while, too.
That's why I did this lecture on aging. It's because I'm going to tell you the secret on how you live to be 900. What do you think? There's the secret.
Oh man, 900. That'd be
I can't wait to hear it.
Well, I think if you hear that kind of crazy stuff out of me, you ought to ask about the second part of the lecture, which is to keep from being demented. You know, you've got a reasonable chance to live to be 85 years old in good shape. And some of us will do longer. And Mary and I are getting close to that number 85, and we're starting to think, well, maybe I really meant 95.
Yeah, well, what did we see on 60 Minutes last night? We saw Rita Moreno.
Oh, yeah.
She was 95 and she
was
great.
Great. And she was great in the movie too. Yeah, she's amazing. Well, I just had a 100-year-old on my show and she had all her marbles. She was amazing.
Yeah.
Well, I think you have a better
that's
chance.
Our goal.
If you take good care of yourself, you have a better chance of making it to a longer life and a better life. You know, the rules are the rules, you know, and there are a few exceptions, but not many. And usually you can figure out why they're exceptions if you take a close enough history on them.
If you look close enough, yeah.
Dr. McDougall, I know you have company today. It's 1 o'clock. So shall we say goodbye? And then maybe you'll come back in a couple of weeks and answer the questions we didn't get to.
Yeah, it was fun.
Yeah, it was a lot of fun. Mary, you are on fire today. You should write a book on what it's like, what the real Dr. McDougall is like.
What the real life.
I'll tell you, why don't you just have Mary on next time?
Hey, I believe me, if we got questions for her, we would love to.
Well, we enjoyed it too, AJ. And I think you're doing a wonderful service.
Thank you.
Having a whole bunch of good ideas on, and And I really appreciate you asking me about some of the ones that bother you a lot. Because when people teach things that are harmful to people I care about, which is you folks, and I'd like to give you another point of view, just like recommending these oil supplements, DHA and EPA. It's not a good idea. And there are a few other things that come out that people recommend that
And olive oil. Yeah.
that are not good for you. And I'm happy to talk to them about it, but I'm happy to talk to you too.
Nice. Well, we'll see you in a couple of weeks then. We're so
All
excited.
right. All right.
Thank you
guys
so
have a-
much, Dr. McDougall and Mary. And thanks all of you
Good
for
night.
watching another episode of Chef AJ Live. Please come back tomorrow when we have a wonderful culinary demo with